Hi everyone, it's Nishti here, specialist dietitian for children and parents. We have a lot of children who have reflux, and they were missed for also having an allergy to cow's milk. So I want to show you today how reflux is often misdiagnosed for just being reflux, but in fact, it turns out to be, in some cases, an allergy to cow's milk. And there are some guidelines out that actually suggest that if a child has reflux, then the clinician should pay attention to whether it could be an allergy there as well. Because cow's milk allergy, remember, it affects the skin, the gastrointestinal tract, and potentially also the respiratory tract. And therefore, reflux is also one of the symptoms of cow's milk allergy. So if your child has reflux, but also loose stools and they're colicky, and perhaps they have hay fever-like symptoms, is it an allergy to cow's milk? And is the reflux caused by the allergy to cow's milk? This is what I think we're still not very good at. We tend to put children on medication, and we tend to miss that perhaps there is actually an allergy here. So let me just share with you my screen and some guidelines that may help you if you're interested. So these guidelines here from 2022, diagnosis and management of food allergy-associated gastroesophageal reflux disease in young children. So we cannot deny that reflux is very common in the first year of life. If it becomes very troublesome, then it's called gastroesophageal reflux disease rather than gastroesophageal reflux. And this paper is brilliant. And if you want to, you can find it and have a read. Whether you're a healthcare professional or parent, this is very, very relevant, because this paper suggests that if a child has reflux, first of all, we always need to consider a food allergy focused history. So the clinician needs to look into whether there is anything there, any red flags that could suggest that this child has, in fact, an allergy to cow's milk or any other allergy. And it also says here that the presence of other GI symptoms typically associated with non-IgE mediated and or eczema may increase the likelihood of gastroesophageal reflux disease being food allergy associated. Now, what does that mean? If a child has reflux but also has eczema, for instance, then it does increase the risk and suspicion that this child actually has an allergy and the reflux is a cause of the allergy. So perhaps we can prevent medication if we know this. And this is what this paper really, it has all these other approaches first before medication is considered. A lot of children are just put on medication straight away. But if you look here, it also says here that they recommend in children that you first try and thicken the feeds. So for example, you can use a thickener to thicken feeds. Here in the UK, we use Carabel, for instance. And food allergy needs to be considered for sure. And you know what? There's no harm in doing a 2 to 6 week diagnostic elimination of cow's milk. So if you're breastfeeding, you go dairy-free. If you're formula feeding, you need specialized formula that's milk-free, because what this may help with, it may help to diagnose whether it is in fact a food allergy or not. Okay, so let's say your child has eczema and they have reflux and they have colic and they have loose stools, diarrhea. What I would do would be to take a food allergy focused history, and I would consider putting your child on a dairy-free diet, whether you're breastfeeding or formula feeding. That's what we would do. If things improve, then brilliant. Then we put the dairy back into the diet to diagnose that this is in fact a food allergy. And most cases, what we do here at Nishti's Choice, this is what we do. We follow these guidelines because I'm all for trying a no medication approach. If we can do it without medication, brilliant. If we need it, of course we need it, then we need to go ahead. But there are so many times where, in fact, the child had a food allergy and the reflux was exaggerated because of that. And therefore, treating the food allergy also helped with the reflux. And that's why this paper, I just absolutely love it. And it's, it's very scientific. And here there is even a diagram. So for example, in infants with signs of reflux disease, you take a detailed history. Is there a family history of allergy? Is there any atopic dermatitis or eczema? Are there any other manifestations that could suggest food allergy, like diarrhea, colicky pain, irritability? Yes. Well, if you're breastfeeding, dairy-free for 2 to 4 weeks. If you're formula feeding, again, dairy-free through the prescription formulas that we have, specialized formulas for 2 to 4 weeks. And if there is an improvement, then we still need to diagnose it. If there isn't any improvement, then perhaps consider any other allergies or allergy testing. So you see, this diagram is just fantastic. And we do a lot of GP training, and I show this to all the GPs that we work with, because usually that's where parents go first. And if we can educate our GPs on this, then perhaps we can reduce the need for medication so early on in a child's life. So have a look at this paper. And if you need any help and support with your baby, please reach out. We provide online help and support to parents, families all over the world. Please email us on info@nishtischoice.com. I'll see you all in the next video.